Hey everybody, Organized Biology here, and today we're going to be going through NCLEX review number 2. This is going to be 3 multiple choice questions, so let's get started. This first one is going to deal with reduction of risk potential, basically saying, hey, we're trying to diminish the risk of our patient having some sort of adverse effect or reaction. So here's our question. You're helping a patient with gout. Select her dinner. Which of the following would you most likely recommend? So the big thing we need to know with gout, remember, is gout is usually caused by flare-ups that is dealing with uric acid buildup. And uric acid usually builds up whenever you eat foods that are high in purines. And we know that purines are also high in things that have a lot of protein. So things like meats, things like legumes. Whenever we have a high protein meal, we have a lot of purines. Therefore, we're going to have uric acid flare-ups and the gout could get worse. So we're thinking, hey, which of the following will have the lowest protein content? So in the first one, we've got a hamburger, fries, and salad. That's not going to be good. Hamburgers get a lot of protein. Second one, liver and onions on a dinner roll. First off, I think this would be clinical malpractice to even recommend liver and onions, but because liver is a protein primarily, we're not going to recommend this. Pasta with tomato sauce and green beans. This would be a very good one to choose, a little lower protein content. And then last one, baked chicken breast with rice and steamed vegetables. Once again, we get the chicken breast, so high in protein, we would not want to recommend that. So the correct answer would be C. So number 2, this one is going to deal with physiological integrity. So we're talking about physiology here. So the functioning of your body, how atoms and chemicals are working together. So in this case, we've got a child vomiting excessively. So which of the following would we be most concerned about? So we've got respiratory alkalosis, dehydration, metabolic alkalosis, dehydration, respiratory alkalosis and dehydration, and metabolic acidosis without dehydration. So look at the question. We are losing fluid from the stomach through vomiting, right? And we know that the stomach contents have a lot of acid. So in this case, if we're losing this, we have acid loss. So literally we are losing a bunch of hydrogen ions, right? So if we're losing acid, we become alkaline. So in this case, we're going to be looking for alkalosis. Secondly, when you are vomiting, you're not only losing acid, you're just losing general fluid as well. So therefore, we are going to expect some dehydration with this patient. So looking here, we've got 4 answers. The first one, respiratory alkalosis and dehydration. They've got the 2, right? But none of this deals with the respiratory system. Remember, respiratory alkalosis and acidosis deals with carbon dioxide and oxygen exchange in your lungs going to your blood, and this has nothing to do with it, so this would be incorrect. The next one, metabolic, which is basically all the chemical reactions in your body elsewhere, right? Alkalosis and dehydration. This would be true. We're basically losing the acid through vomiting, makes it alkaline, and we're losing fluid, dehydration, metabolic. Wonderful. Let's check the last ones. Respiratory, once again, that would not be correct. Metabolic acidosis without dehydration. This would not be true because remember, we're becoming more alkaline and we are losing fluid, therefore we are being dehydrated, so D would not be correct either. All right, last one, y'all. We're talking pharmacological therapies, so we're going to be talking about medications in this one. So which patient should not be prescribed Alendronate, okay, that's Fosamax, for osteoporosis? All right, we've got a female patient on ACE inhibitors, a patient allergic to shellfish, a patient on calorie restriction, or a patient on bed rest who remains in a supine position. So just a brief little review. Fosamax, okay, this is a great drug to treat osteoporosis because it will basically slow down the breaking down of bone. So it's great for the elderly patients who naturally have a little more osteoporosis going on. Now, remember, Fosamax, the main symptom that you may experience with this is what's called esophagitis. This basically means inflammation of your esophagus. The reason for that is it actually delays esophageal emptying. So that tube that goes down to your stomach, it's got to open and close when you swallow and bring food down it. And this drug can sometimes slow the rate by which it does that, okay? And in doing so, it can kind of cause some inflammation, some stomach gas, it can reflux back up. So a lot of patients have issues with their esophagus, so keep that in mind. All right, the last thing you should know about Fosamax is this needs to be taken on an empty stomach, usually with around 2 ounces of water. And you should wait about 30 minutes before eating and drinking or laying down. That background probably helped you answer this question, right? So look at these. So female patient on ACE inhibitors. Fosamax really doesn't have a ton of drug interaction, so we're not going to worry about ACE inhibitors. It's not going to negatively affect this at all. Patient allergic to shellfish. Once again, this drug won't impact that. A patient on calorie restriction. Not really, because we're kind of restricting them from eating and drinking in the first place, so that's not going to affect it. So the correct answer will be D, a patient on bed rest remaining in a supine position. Remember, supine basically means laying down, palms up, And so why would this be bad? Because remember, it's dealing with the esophagus and reflux and the inflammation of the esophagus. So if you're laying down, it's easier for that reflux to occur, right, rather than being straight up and down. So if you have patients who have to take this, you should instruct them to stay upright for at least 30 minutes after taking this drug. And there's review number 2. If this was helpful for you, please subscribe to the channel Organized Biology and go ahead and watch the other NCLEX reviews that I will be posting subsequently to this video. Thanks again.